Hey everybody, it's Dr. Daria here, and today I'm going to talk with you about a breathing technique that I've been working on. And this is about holding your breath. So a lot of people, when they're feeling stressed, someone will usually tell them, oh, just, take a deep breath. And inhaling deeply is probably one of the worst things you can do to calm your body and restore normal breathing patterns. And this is because you're over oxygenating your body, which doesn't allow the normal breathing patterns to be restored via the neurocircuitry of your brain. And it doesn't allow your body to offload oxygen to your tissues so that you're actually getting oxygen where it needs to go. What you really need to do is increase your CO2 levels and your tolerance to CO2 levels, CO2 being carbon dioxide. This is because CO2 is what gives your body a signal to get your breathing back to normal the way it was intended to be. And by holding your breath, starting slow, building up, you increase the sensitivity, or you make yourself less sensitive to CO2 so that you can tolerate more and more, and your body can offload oxygen better and better to your tissues. Your breathing pattern can become more and more balanced and regulated. Increasing tolerance to CO2 has been shown to help with many things, including autoimmune diseases like skin disorders. It's been known to help especially with anxiety and depression, anxiety specifically. So, a couple things to note. Please don't do this breath holding technique if you have cardiac issues, heart problems. Don't do this if you're pregnant. Definitely talk to your doctor before doing this if you have any other health concerns. And if you do suffer from anxiety, you want to go real slow and be real gentle with yourself with this, because someone who is anxious will tend to overbreathe or over oxygenate. It may be very difficult for you to do the breath retention piece. So just be very patient, give yourself a lot of space around that. You may just be able to hold for 1 second and work your way up from there, and that's fine. If you're starting to feel your breath get kind of ragged or scraggly, aka it's not smooth, you need to hold for less time, reduce the time of the breath in and out and holding. And lastly, you want to breathe through your nose the whole time. The reason for this is mouth breathing will disrupt the neurocircuitry of your brain that is necessary for normal breathing. So as much as you can, keep your mouth closed. So let's try this technique together. So it's pretty straightforward. And I'm gonna do inhale for a count of 4, exhale for a count of 4, hold for a count of 4, and repeat that. So if this feels very easy, you can increase that count. And if it feels very difficult, obviously decrease it, and you can just decrease the hold time. So you might just do in 4, out 4, hold 2, or in 2, out 2, hold 2, or 1, 1, 1. Whatever feels doable to you. You don't want to feel like you're dying, but you do want to feel that slight bit of air hunger where you feel like, okay, I need to inhale now. So let's just try it together. We're going to do the 4 count. So you're going to inhale through your nose, exhale through your nose, hold, inhale nose, exhale nose, hold, and you would repeat that for about, I don't know, a minute or so, working up to 2 minutes. Then the progression would be that you increase your exhale time and your hold time, but the inhale time stays the same. So you might inhale for a 4 count, exhale for a 5 count, hold for a 5 count, and do that for about a minute to 2 minutes. A wonderful practice. It has lots of health benefits, so try it out. Let me know what you think. Thank you so much for listening. Have a great day.